Hello, everyone. It's Dr. Durst with RevitalyzeMD, and I have beautiful Caitlin here today, and we're going to do some Botox on her. Again, it's a Verb, so Botox can be Dysport or Xeomin. It can be any of them. And Farideh is going to perform this wonderful procedure on her, and guess what? She's a newbie, just so you know that. So I don't know if you know what that means, but this is her first time. She's the first time she's getting it, so everybody's always a little bit nervous. So we did put some numbing medicine on because we were new. We were going to have a little time drawing it up, doing the video, and so we were going to make it as easy as possible on her. So anyhow, we're going to talk about where we do movement. She might not be the perfect candidate to talk about all the different treatments because, again, she doesn't have a ton of movement, but it is the age to start. So if you're going to get dynamic lines because of movement, then you want to start young so that you can prevent that from happening. So she's got a smooth forehead, but go ahead and lift up. Look at all that movement that she's got going on. Now do it again. Look at all that. She's got tons of movement. So again, those will all form lines if she continues to move like that. And so now she needs less because she'll be very responsive. Her muscle will respond to it. And then if you stay on it and do it every 3 or 4 months, then you need less of it because you also can train yourself not to move. This is the glabellar area. So this is our frown area. So hopefully she's not frowning at me too much during the day. But these muscles get really strong when she is. So go ahead and frown for me. So they're pretty strong already. So basically, here's a procerus muscle and these are corrugator muscles. These are all going to depress down. So basically, they're depressing. So when we block them, you're going to get eye lifting. And so an opening. And so it makes you look more awake. And then these are your only depressors in the frontalis. So go ahead your only lifters. Sorry, misspoke. Go ahead and lift up again. So those are lifting. So if anybody was worried about forehead lines and that's all they wanted, we would not be able to do just forehead lines because we would block everything up here and then go ahead and frown again. You would drop this brow down like she is now, even though she's making a specific movement. This would be heavy. So if you're going to treat forehead lines, you have to do the frown lines with it. And so that's going to lift everything up when we're getting rid of these forehead lines. In here, go ahead and frown again for me. So you can see she's got really strong muscles there. But because, again, actually we'll take all of this off. So that numbing medicine we're going to take off for her, and then we'll alcohol swab her down, and then we'll mark those different areas that we're going to inject, and then Farideh is going to inject them. The crow's feet is another area that you can do a treatment in, so go ahead and smile for me. So she really doesn't have a lot of lines over here, but we're going to do just a couple units up here to do a brow lift, and then we're going to do a couple units right here, because she just has a little bit of movement there. Not a lot, though, and again, you know, if you wanted to minimize your cost on this and you're young, sometimes we don't have to hit the crow's feet. We're going to do it with her just to kind of show you that we can do that brow lift with it. So frown for me again. So we're going to just mark the areas. This very dull pencil. And then we're going to, all right, perfect. And then go ahead and lift up. And so then we're going to mark those areas. And so what we try to do, again, there's not always a lot of muscle in the middle here, so you don't need to always place a lot. Some people will have movement there. And then go ahead and lift up again, a little bit over there, you know, just to make sure we hit this. Sometimes we'll go a little bit light the first time because we're just getting to know someone. And we would rather go light and add some units later than to make you heavy, not happy, and then come back in and there's nothing we can do about it for 2 or 3 months. Lift up again. So again, we're hitting that whole frontalis muscle, which is creating all this movement. We kind of stay away from the middle. And then this is like the point of maximum lift on the brow. It's kind of something we're particular about at RevitalyzeMD, only we're all doing it the same way. So you're going to get the same injection technique, the same skill level from any providers here. And so we're going to make sure to maintain this maximum brow lift. So we're really not going in that area right above there. And we'll go a little bit lateral to hit that movement. And then you can still lift, which still creates the brow or has the brow being high. So we don't go there. We'll go a little bit lateral to it. And then again, normally we're going, close your eyes for me, really tight. This whole muscle is a orbicularis oculi. So you can actually do upper, middle, and lower when somebody really has crow's feet and hit them, but she doesn't have much in the way of movement, so we're going to hit the upper part and do a brow lift, and we're only doing a couple units in each. And right there, the only places she has movement, and so we'll go ahead and hit this. All right, you ready to do it?
Yep.
All right. You're going to do just fine. We even numbed your look. We're just going to pet her and make her feel comfortable.
Go ahead and sit down.
All right. So then there's other areas of the, that we can hit with Botox. And again, Botox is always a verb. You can do Xeomin, you can do Dysport. And so it really depends on what you want to have done, what your favorite product is. We'll always have our favorites, so if you don't, we may, guide you and give you information on each one of those and how they're different. And so basically with any of them, they're going to block muscles. So they all work. They're just some minor differences in each of those products. So if you're interested, we're going to do another video. So definitely, I want you to subscribe, and comment. Let us know anything else you might want to hear more about. But all of these products are going to block muscle, all of them. Some people might get used to it. One is a little more natural. One might be a little more natural in that it doesn't make you frozen. And if you don't know what frozen is, that just means you don't want any movement. And so you only really know that if that's what you want. And so that's okay. But we just need to know, because then we'll direct you towards a different product, or we'll maybe treat it a little bit differently and stronger. And you won't know that the first time in. How is that?
That's good.
Okay. Good.
You can't really do it.
We can do bunny lines in the nose. So if you have some scrunching, on the nose. We can also treat the masseter. So this will thin out the face a lot just by blocking the masseter muscle right here. And so it basically, you don't have that jaw that's very thick in a woman or very broad on the lower part because you have a strong masseter. We can actually block that masseter. You'd still be able to chew. You just have thinning of the face. And then likewise, we can do it around the mouth. If, say, you have, almost what we call smoker's lines, but it's not always from smokers. It can be just because you drink from a straw. Maybe you're smooching too much, something along those lines. That will happen. So
just have this side.
All right. And then the other thing to keep in mind with neuromodulator is that we can also treat musculoskeletal pain. So basically, if you have pain in the head, neck, 85% of that is musculoskeletal. So we can do temporalis muscles here if you get headaches in the upper. Sometimes your headaches could just be from your masseter or jaw. And then likewise, you can actually get headaches in the back. And we'll talk a little bit more about that when I get to the other side. But it significantly helps with pain. And so again, 85% of head neck pain is musculoskeletal. So if you're blocking that muscle that's causing the pain, I'm going to show you the different areas. So you're done.
Yes,
Did you survive? Did you survive it?
I did. I'm still
I know.
breathing.
She was a little nervous. So just so you know, people get nervous the first time. It's common. So other areas that we can treat. This is a big temporalis muscle right over here. So sometimes people have headache and tension headaches because they're always clenching down. So this masseter can be very, very strong and big. And so it makes our jaw look bigger. So if we're actually injecting this to paralyze it, then you get thinning of that. And then you can also, from that tension, you're either clenching your jaw or you're clenching over here. We can paralyze this up here and it helps with headaches. Just the frontalis and the forehead wrinkle lines and treatments can help with headaches. And then back here, you have occipitalis, even your trapezius, upper trapezius, you can block and get relief of. So even if you're having headaches, things you didn't think about, you can treat with Botox. Again, a verb, Botox. Mm-hmm. I just mean neuromodulators, which are Botox, Xeomin, Dysport, the three that we use. So again, if you have any comments, questions, things you want to hear about, let us know. And we'll definitely cover it on future videos. And hopefully this helped you understand a little bit and see the treatment when it's done. And go ahead and share with friends, like, subscribe, follow. And again, share your experiences. We want to hear about them. So come see us and let us revitalize your look, your health, and your sex life. Thank you.
Thank you.